When the only constant in life is change, you need to be ready. This is the Man-Made Survival Show.
Hi everybody, my name is Jose Prado, Man-Made Survival, and I'd like to thank you so much for coming back to the channel and watching this video. Thank you so much for sharing the information that people have been sharing, and everybody that has liked the videos, commented the videos, subscribed. Thank you so much for doing so. Not only on YouTube, but on all the other platforms such as Brighteon, Twitter, podcast, and Instagram. I'd like to thank everybody for doing so. Thank you for sharing this information, because I do believe that this information is very, very important and very, very serious, especially because people are going to have to get ready here in the days ahead, especially with all the things that are going on in the world right now. So I have these articles right here, but something happened in Anniston, Alabama. Okay, the Health and Human Services coordinated with FEMA to take coronavirus, or people that had tested positive for the coronavirus, that came off the ship, the Diamond Princess, and take them to the FEMA Center for Domestic Preparedness in Anniston. All right, and they did not give the local authorities much of a heads up. As a matter of fact, today, Sunday, they had a meeting, a council meeting, and they said straight up that that they were told pretty much last minute that they were gonna take coronavirus evacuees from the cruise ship and take them to the FEMA Center for Domestic Preparedness. Pretty much just giving a heads up. So a lot of people freaked out. There were people at the council meeting that morning, or this morning, and they were saying that they did not want people to go there to be quarantined at the local FEMA camp there in the city of Anniston. And I agree with them. I understand why they would do that. The same thing happened in Ukraine a few days ago, to where they actually rioted, and they didn't want those people there because it's very deadly and it's very contagious. Now, some people feel a certain way about it, and some people feel another, right? Some people say, they're going to be okay. They need to be quarantined. They're going to be at a good facility that takes care of it. Some people are saying, no, this thing is very contagious and the facility is not properly equipped to handle it. And if, somebody gets sick, then they're going to spread it out and everybody's going to get sick. And there's legitimate reasons to be concerned about it, especially coming from the CDC, because this is what they have stated here in the past week. All right, here's one of the headlines. Coronavirus test kits sent to states are flawed, CDC says. This is from pharmacist.com. CDC reported Wednesday that some of the coronavirus testing kits that were sent to a state laboratory are not working correctly. And here's a quote. Obviously, a state wouldn't want to be doing this test and using it to make clinical decisions if it isn't working as well, as perfectly at the state as it is at CDC, said Nancy Monsignor, MD, director of CDC's National Center for Immunization and Respiratory Diseases, said at a news conference. And that is right, because if people do let's say that they do take them to Anniston, Alabama, and one of the nurses, somebody gets sick, right? And then they get out and they start infecting people. They won't be, the state of Alabama will not be able to test anyone. So if the kits are bad, they're just gonna say that people are sick with the flu and send them home. All the while, those people are infecting even more people, and that's how you have an outbreak. Here's another headline, which would give the people in Anniston another reason why they wouldn't want people to be taken there to be quarantined. And here it is. Only three U.S. states can test for coronavirus, says Public Lab Group. And this is from CNBC.com. California, Nebraska, and Illinois are the only U.S. states that can currently test for the coronavirus, the Association of Public Health Laboratories told Reuters on Friday. The U.S. Centers for Disease Control and Prevention, which is the CDC, last week said some of the testing kits sent to U.S. states and at least 30 countries produced inconclusive results due to the flawed components, and the CDC planned to send replacement materials to make the kits work. So there you go. There's another reason why I say that the people in Anniston do have the right reason to not want people to be quarantined there. All right, they're gonna be taken, as I said, to the FEMA Center for Domestic Preparedness. Now, the governor of Alabama, which is Kay Ivey, she came out on a statement and said that when she talked to FEMA and everybody else, you know, they had to talk to, they said that they actually they weren't going to take them there. They were planning on taking them there as a backup plan if it happened like in California, to where the judge blocked people be taken to a quarantine facility. So if that happened here in this situation, but not in Alabama, but if another state said no, then Alabama would have been the backup plan to go to. All right. Now, in the article, it said that if the people that were already quarantined, or not quarantined, but that were evacuated, they were presenting no symptoms or mild flu-like symptoms, and they were already, you know, confirmed positive with the virus, with coronavirus. Now, also in the article, it said that they had pre-identified hospitals that would take care of these people if they became very ill. All right, but there's only one or two hospitals in Alabama that could possibly take care of them, which would be the University of Alabama in Birmingham, or it would be St. Vincent's, you know, St. Vincent's East, or the or any other hospital. But let's remember a couple things. In China, the nurses and the doctors have gotten sick. All right, and right now there's a lot of speculation going around with the virus. People saying that it's not as bad as we think it is, or, you know, people are making it out to be, and that's what made doctors and nurses over there in China to get sick in other places. All right, so if the same mentality is here with the nurses and the doctors in UAB or whatever other hospital they decide to take them to, then they will more than likely get infected and then spread it all within the hospital. Now, from Anniston to Birmingham, they would have to go through two major cities, which would be Pell City and Leeds, you know, all through I-20. Anniston has a population of 21,770 people, according to 2017 census. Pell City has 13,676 people, also according to 2017 census. The city of Leeds has 12,031 people as of 2017, and Birmingham has 210,710 as of 2017 census. But here's the thing about this: even though they do not sound like a big population, which they really not, it's not a big population in the cities, especially Birmingham. What happens is that a lot of surrounding areas go to Birmingham on a regular basis. So all these numbers combined with all the other cities around it, you can go in the millions very quickly, especially since there's a lot of churches in Alabama. All right, so people will get sick. Let's say they do take somebody quarantined to UAB to be treated. A nurse, a doctor, somehow somebody gets sick. They start spreading it in the hospital. And UAB hospital is very, very visited. All right, it's the main spot for people to go for a lot of things. So if those people get sick, then they take it to their towns. And then all those people that go to church, they will get all the churches infected. So I say this because, yes, Anniston they do have the correct reason to be worried about this. All right, I'm going to show parts and pieces of the video from the council meeting this morning and what some of the people said while they were there. Here we go.
I was so upset because we got families. We got a community here to work together. And we have children too. Our kids don't want to We don't want to lose our children. We don't want to lose our people that are in the elderly home. This is supposed to be Alabama as part of America. It spreads from here. It's going to spread everywhere else. There's no cure right now. They don't know where, how actually far distance these people are going to be from us. They think that the face mask is going to help. No, this is all airborne stuff. They don't know.
But I mean, they haven't even got to see if we could have like really worried. Why get so worked up with all the facts that we're going to do?
I'm so worked up because they should have came to work this out before getting. In other words, he just stood there, just said a while ago. When they don't know how they're all going to come over here like they are. This is all stuff we have to realize to face. We don't know how they're going to take them off the plane or put them on the plane or end them getting closer to us. We don't know. This is infuriating. I'm frustrated about that, I'm just so upset with the fact that they're not working with our community. And it's supposed to be about working as far as the American people here. And they're just pushing us aside. It's just so wrong. It is so wrong.
All right, as you saw that lady said, that we have kids and everything she was worried about. Yes, that is true. The last thing you want is for kids to get sick. And like I said, there's a lot of churches in Alabama and a lot of people will get sick very quickly. As we have seen in South Korea, there was an explosion of coronavirus infections within the church. So anyways, now, as I've read on the comments on there, there's a lot of people that are pretty much in denial, all right? But I want to say to the people that are to the people who are worried about it, I want to tell you that you need to go ahead and get prepared now. Even if the governor came out and said that it was just a backup plan, there's no guarantee that they will not take him there under the cover of darkness, or that the backup plan, is going to be active and they're going to be taking them there. So you need to get ready right now. You need to have everything you need to be able to be quarantined. All right. Like we've seen in Wuhan, we have seen in Italy, we've seen that in South Korea. Suddenly, everybody is quarantined. Nobody can go anywhere. And whatever you have at home is all you have. All right. And we've always seen this in the southern states. When there's going to be snow, everything gets empty off the shelves. So if there's the smallest whisper of the coronavirus had spread in Alabama or in the city of Anniston and surrounding areas, everything's going to be off the shelves. So you need to get ready right now. You need to have your food, your water ready. If you're on food stamps and you think that you don't have the money for it, use your food stamps. All right, $20-$40 worth of food stamps that you would use to set aside for preparedness. It will take you a long way and it's gonna last you a long time. But the main thing you need right now, before anything else, is your food and your water. All right, and then you want to get your masks. And then you want to get your protective goggles, because coronavirus can be breathed in. They can go through your eyes, through the mucous membrane, so it can go through your nose, and now you're infected. And you have to be able to talk to your family, or if you have children, to get them to understand that this is serious and they cannot go anywhere, talk to anybody, or not get sick or in any kind of way. So people of Anniston, you need to get ready right now before anything happens and they do not let you get out, or before they say, whoops, you got out. All right, so you have to be ready today. You need to get ready, because if they do go on with the plan, the backup plan, they're supposed to be there on Wednesday, 3 days from now. So you would have, 3 days to get ready just in case it leaked out? Or, well, not 3 days. Let's say you have a week or two to get ready. We don't know. The point is that if you feel so passionate about the risk, you need to get ready right now. All right? Again, my name is Jose Prado with Men Survival, and please be ready.
The Man-Made Survival Show.